my name is Amanda Curvilla. I am a first-year PEDS resident at Geisinger in Danville. I think that in general, PEDS is just a little bit more fun. It's a little bit more colorful. We do a lot more like stuff together, especially like outside of work and things like that. We like very frequently attend trivia in town, like literally like a weekly basis. There's like a couple of PEDS tables, which is really nice. Everybody is super supportive. We have lectures where it's not just like attendings who are telling us things. It's also like different residents who are either presenting things, or we're doing like wellness talks, or we're just making sure that like everybody is comfortable with what's going on. Or we have like intake rounds, which I also really like, where we talk about different patients every morning. And sometimes we even have things like if we have difficult patients or we've had like a really bad week, we'll kind of like decompress about that. So I think that everyone kind of cares about each other and our patients, and we sort of find ways of including all of those things in taking care of ourselves and our kiddos. I guess I knew coming in that it was really like supportive, but I've honestly been even more surprised by just how much, I guess, because I feel like I've asked the stupidest questions to certain attendings and certain upper residents, but they've answered it like it was a completely reasonable thing to want to know. So I think that just in general, everybody is like waiting for you to learn, and everybody's like really enthusiastic about it. Like I'm being like, sometimes I'm getting over explained things. Someone's like, I really want to make sure you're comfortable with this before you have to get thrown into it. So like I really appreciate the fact that like I never feel like I have to really know what's up. I get a lot of like support before I have to go deal with the situation myself, which makes it that once I've sorted it out and I know what I'm doing, I'm extra confident in what I'm doing, because I know that it's not just my flimsy knowledge, it's my knowledge backed up with everything that other people have taught me. So I feel like it makes it makes me feel just safer and more confident in how I'm approaching patients. I want to go into sports medicine, so I want to go into a sports med fellowship after this, and like ultimately my goal is to have like a nice little sports med clinic where kids know that this is like a place they can go for certain things. Maybe have like some athletic trainers and physical therapists who also help out over there. So we have like a one-stop shop, so they know that they have these resources for them. I'm currently on a hem-onc service right now, and we have a patient who's been really nauseous and like struggling to like get all of her oral medications down. And one of the things that we spent some time doing, like me and the attending, was just chatting with her and figuring out like what things she likes, what stuff can like put her in like a better mood, so she's focusing on something besides the nausea. And we spent like 20 minutes like sorting through this, and then we gave her medication and we like did all that. But then we spent a whole bunch of time afterwards literally watching like dog and cat videos, because that's what she enjoyed. And like it was just like a good like 30-40 minutes spent in the room just like trying to put her in a good enough mood to be willing to take her meds. And I think that was a really good experience. I don't think every attending would do something like that. A lot of the attendings here would, because everyone's just ready to go for it. But like in previous experiences, it was kind of like, well, she's not taking the meds, well, we're gonna find something else to do. But this was like a lot of time spent to try to help out our patient in whatever way was best for her. I think that the program is really great with accommodating us, as well as just making sure that we're happy with things and continuing to ask for ways that we can improve, and always giving us a chance to participate in things that are happening. And I think that's really fantastic. And I think that like as an incoming learner, it's really important to be part of something where you don't feel like you're trapped in anything, that you have like the flexibility to move around and make changes as you think necessary. I mean, I'm like 3 months in, I'm having a really great time. So I think that's a really great place to be at the moment. So I think that's what I'd like to add, to say that like, it's a really tricky transition. Like it's definitely hard coming into residency, but once you get your footing, it's really fun, if I'm being very honest.